Okay, so we're going to start off this exercise program in a series of different positions. This first position is a standard position to start with, lying on your back, knees bent, feet flat. I'm going to take you through a couple of the basic exercises. The first one is called single knee to chest. For this one leg will be down, one leg is bent. You're going to grab a hold of your leg like so, and basically you're trying to bring your knee up towards your chest to stretch your hip area. You hold for about 5 to 10 seconds, and then you rest. And we're doing about 5 repetitions on each leg. If you have a knee problem that doesn't allow your knee to bend this far, you could reach underneath the knee and grab the leg bone, pull it up. If reaching the leg is a difficult thing for you, sometimes a towel behind the leg like so is a way to get the knee towards the chest without having to grab it. Set the leg down, slide up, slide the next one up, and you work at both legs. Maybe about 5 repetitions on each leg. This is a basic stretch for the lower back. Next stretch is double knee to chest. For this one, you would grab both knees and then gently bring the knees towards the chest, holding for about 5 seconds, breathing normally, trying to relax into the stretch, then release. And we're doing about 5 repetitions of this one. Again, if it's uncomfortable to grab on top of the knees, you could grab behind, or you could use a towel under both legs, like so, to get your knees towards your chest. So that's called double knee to chest. That's exercise number 2. Exercise number 3 is basically a groin stretch. From this position, you allow the legs to fall apart, and basically you're just allowing gravity and time to stretch the muscles down, the knees towards the floor. You should feel the stretch in the inner groin area. You hold for about 5 seconds, then you take the stretch off and rest. And we're doing about 5 repetitions of this one. So this is exercise number 3, groin stretch. Number 4 is lower trunk rotation. This is a simple stretch where you allow the knees to fall to the side, holding for about 5 seconds and breathing, and rotating the other way. You're not trying to force the knee down. You're not trying to produce any sort of crack or pop in the back necessarily. You're just trying to produce a stretch sensation through the trunk muscles. This is called lower trunk rotation, and this is also done about 5 repetitions. Another basic stretch is to stretch the hamstring muscles on the back of the leg. This can be done a few different ways. A basic stretch is to grab a hold of the back of the leg. The other leg could be bent or straight, whichever you prefer. You straighten the leg as far as it'll go, and then use the hands to try and bring the leg up towards your head, feeling a stretch in the back of your leg. You hold for about 5 seconds, then you release and rest. Again, you could use a strap behind your leg if you prefer to hold the leg without having to reach behind your thigh. This is called hamstring stretch, and again, we're doing about 5 repetitions on each leg. That completes, there actually is one additional exercise. From this position, we also can start doing some core strengthening of the abdominal muscles. A very basic exercise in this position is called a pelvic tilt. We start from this position with the head down, hands behind the head, and basically you're trying to flatten your lower back towards the table, tightening the muscles in your abdominal area. You should be able to breathe and not strain with this exercise. You hold the contraction for about 5 seconds, and then you rest. So the lower back flattens towards the floor, and the tailbone tilts a little bit. So the abdominal muscles contract. You should feel some tension in your abdominal muscles without contracting the breathing muscles. 5 seconds, and then rest. That's a basic exercise. A little variation of that one is to do the pelvic tilt, flattening towards the table, and then try to pick your shoulder blades an inch or 2 up off the floor, hold, and then back down slow. So again, it's flattening the lower back, keeping the muscles tightened. Raise the shoulder blade without bending the neck, without pulling on the neck. Hold for about 5 seconds, and then back down slow. And these ones are usually done in repetitions of 10 to 15 repetitions at a time. They're used to strengthen the abdominal muscles. That completes the series in this position. Next, you would move to sideline position. In this position, we can work on stretching some of the muscles of the thigh. The first stretch we'll do is to grab a hold of the ankle. In this position, try and bring the heel towards the butt and the ankle, the leg back slightly. This stretches the quadriceps muscle in the front of the thigh. If it's uncomfortable to reach back and grab your ankle, you could take your towel, loop the towel around the foot, and then use the handle of the towel to bring the heel towards the butt and get the same effect. Again, 5-second holds, doing about 5 repetitions. You should be able to breathe and relax into all these stretches. None of them should be extremely vigorous or difficult to do, but should be a relaxing stretch, basically. A slight variation of this one is to reach up with the heel of the bottom leg and try and bring the knee down towards the floor. This stretches the band of tissue on the outside of the thigh, which is very commonly tight. So again, in this position, I'm using my left foot to push my right knee down towards the floor, holding for about 5 seconds. And this is the second stretch in this position. The final thing that we'll do in the sideline position is another core strengthening exercise. For this one, we're braced up on our elbows, so the elbow is underneath your shoulder. We're going to try and bring the body in one straight line, so the hips are forward and in line with the shoulder and knee. The top hand can be resting on your trunk, or it can be on the ground for balance if you prefer. You're trying to draw in and tighten those deep muscles, tightening your stomach, lifting the shoulder, lifting the hip a few inches up off the floor so that your body's in one straight line. You hold for about 5 seconds, and then you take it back down. This hand again could be here if you like. Tighten the abdominal muscles, lift the hip, hold 1, 2, 3, 4, 5, lower, slower. And that completes the exercises done in the sideline position. You would then rotate the other way and perform the same series on the opposite side. I'm going to skip that for the video. So our next position is to go to all fours position, like so. If you have wrist problems, or if you have knee surgery or knee problems that you can't kneel, this position you'll have to omit. I'll show you some tips later on in the video for alternative positions to the hands and knees. But if you can do this position, this is a good position to work from. A few basic stretches can be done in this position. The first one is called the cat and camel exercise, and this is basically an exercise where you would round your lower back, bring the head down. This is flexion of the lower back. And then you extend the lower back, your butt and head goes up. This is extension, flexion. So you're basically just trying to work your spine between flexion and extension. Just kind of gently moving between the two. It's not a forceful exercise. It shouldn't be a vigorous exercise in any way. Just a relaxing movement between flexion and extension. The next step from the cat and camel exercise is called the hand heel rock exercise. For this one, your hands come forward slightly. The pelvis rocks forward to wherever you can get to. Pause for about 5 seconds. Walk the hands back. The butt goes towards your heels, and you hold for about 5 seconds. If you have hip replacement or knee replacement, you may not be able to go back very far. That's okay. Just go wherever you can get to. The cat and camel exercise could be used in place of this one. Again, if you have hip or knee problems that don't allow you to rock back and forth. The final step of this exercise is to be able to rock all the way down to bring your pelvis towards the floor, and then be able to rock all the way back to bring your butt towards your heels. So this is sort of the final step of the hand heel rock exercise. Pausing for a few seconds in the repetition. We're doing about 5 repetitions. And the final exercise in this position is another core strengthening exercise. This exercise has a couple of levels of difficulty. The first one is to try and draw in and tighten those deep abdominal muscles, keeping your spine neutral. One leg goes straight back. You hold for about 5 seconds. Then you set down and you alternate. Most common mistake with this exercise is to bring the hip out of alignment of the other hip, or to arch the spine into hyperextension. We're trying to keep everything neutral and just move the leg by itself. This is used to strengthen the gluteal muscles of the hip and the lower back muscles. A little variation of this one, if this feels very easy to you, is to lift the opposite arm and leg. And then alternating opposite arm and leg. Again, we want to imagine that imaginary stick from the head down to the tailbone would stay nice and straight, so the spine stays neutral. It doesn't extend or rotate at all. And we're emphasizing good control and maintaining good position rather than doing this quickly or any sort of jerking motions. So that completes the hands and knees position. Having a chair nearby can be helpful for getting up and down off the ground if that's a struggle for you. This next position is another stretch for the hip muscles. Again, if you have a knee problem, sometimes a pillow under the knee here can be helpful, or you may not be able to do this stretch. I'll show you some alternatives in a moment if you can't kneel on your knees. If you are able to do the stretch, basically you're trying to keep the spine nice and straight, the abdominal muscles a little bit tightened, hips level, and you lean forward so you feel a stretch in the front of your right hip. You would hold for about 5 seconds, and then you release the stretch. So this is a stretch for the hip flexor muscles, the front of the hip and thigh. The most common mistake here is to have people rotate and twist out of position. You want to keep both hips nice and straight, butt tucked under, back straight. And so then you would switch sides, do the other side. From that position, we're going to go ahead and stand. We'll readjust the camera and meet you in a moment. Okay, we're going to share some ideas with you now. If you're unable to get to hands and knees position, and a lot of folks can, there are some alternatives to some of those exercises we did on hands and knees that can be done just against a table or a kitchen counter or something like that. We talked about the cat-camel exercise where you flex and extend the spine. So a simple way to do that in this position is just to practice that same idea of flattening the back and then extending the back. You have some support on the table. This is a way to do it without having to kneel. That hand heel rock exercise can be done by letting the pelvis rock forward towards your hands and then letting the pelvis rock back and stretching like so. This is a great little stretch. This also could be done as an alternative to the hands and knees position if you're in a situation where you'd like to do some stretching for your lower back and you can't get up down on the ground. It's a very, very simple exercise just to move the spine between flexion and extension. And we're working again about 5 to 10 repetitions. The exercise that we did in face down position where the arm and leg went up can be done in this position. It's not exactly the same, but it's pretty close. Basically what you're trying to do here is to let one leg go straight back and back down, keeping that spine nice and neutral. And the alternative position is that alternative arm and leg reaching. Again, emphasizing good control, trying to keep the spine neutral. And those are some ideas as an alternative to the hands and knees position.
Take it from me, Bill Hillgrove, it's the best care, hands down.